Welcome to the TrueRotarian Podcast. This podcast is specially designed for all the true Rotarians by a true Rotarian. A lot of people think even now that the ghee, is dangerous, but the sugar is harmless. How do you?
That what you said, it is opposite. The sugar causes more heart attack than the ghee.
So, what is the early sign that people should not ignore?
The common myth in society that everyone thinks कि हार्ट की बीमारी होगी तो पेन होगा. पेन 25% में होता है. 75% पेशेंट में पेन नहीं होता. They get heaviness and most common in the center. It can be on the right side. Many patient बोलेंगे नहीं मेरे को तो राइट साइड में हार्ट डिस्कम्फर्ट हो रहा था तो ये तो हो ही नहीं सकता हार्ट का, विच इज़ रॉन्ग. इट कैन कम एनी पार्ट ऑफ द बॉडी, जॉ. मेरे पास पेशेंट ऐसे है उसको खाली टीथ में पेन होता है, दांतों में, बट होता है चलने से, रुक जाता है तो ठीक हो जाता है. एंड ही वेंट टू डेंटल सर्जन, बहुत कुछ हुआ ट्रीटमेंट, बट ऑल हार्ट. सो रिमेंबर वन थिंग, एनी सिम्टम अब्रो अम्बिलिकस which is coming on exertion and getting relief with rest in any form of symptom, किसी को choking होती है, किसी को घबराहट, कुछ भी होता है, this is nothing but angina. Don't ignore it. This is the earliest sign which God has given you warning.
Hello and welcome to True Rotarian Podcast, a podcast where we invite different personalities from different walks of lives that change lives and try and help make a better community and a better society and ultimately a strong India. Today, ladies and gentlemen, we are honored to have with us one of the most respected cardiologists in the country, Dr. J.P.S. Sawhney, very senior cardiologist and a chairman of Department of Cardiology at Sri Gangaram Hospital in Delhi. I have included his very detailed biodata in the description box for the benefits of all those who would like to know more about Dr. Sawhney. He has authored more than 241 national and international publications and led India's first clinical practice guidelines on dyslipidemia management. Welcome to TrueRotarian Podcast, sir.
Thank you, sir. Thank you very much, Hemant ji. Thank you very much for invitation. I'm really honored to be with you, and I can see what is the passion you have got to give back to society in a better way. I think this is one of wonderful idea. I think very good.
On behalf of all my audience and all the listeners, I would like to express my sincere gratitude to you for finding your time from your busy schedule. I know a doctor is always busy saving lives. What a wonderful job you are doing. And thank you so much for coming to our podcast.
Thank you very much.
Sir, let's talk straight to the point where everybody is a little concerned. India is witnessing a very worrisome, rise in the heart attacks among people under the age of 40. Some celebrities, some athletes, some seemingly very fit people. Why is this happening so frequently today?
Yes, thank you. Amanji, this is a very, very burning question at the moment, but we must have observed in the media that many people are dying at a young age with sudden heart attack, sudden cardiac death, yes. What we say. So we started looking into the data while we were preparing, as you rightly said, we were preparing the guideline for our country for lipid management. And at that time, we 2022 cardiologists sat together and it took almost more than 3 years to prepare this guideline. And during that period, we look into this fact, why we are getting the problem in such a young age. Mm-hmm. So what the statistics showed us that around 50% of the people in India, they get heart attack below the age of 50. And around 15% of them are below the age of 40. This is an alarming fact because this is 3 times more than the Western world.
Oh, okay.
And so we started looking why this is happening. What is the reason for that? Why we are getting disease earlier? What are we genetically only prone or is it something else? So we found that the risk factors for heart attack like hypertension, sugar, tobacco, lipid disorder, we are acquiring all these risk factors in an earlier age compared to the rest of the world. Number second, we have got certain peculiar risk factors of our country, which are specific to our country, or I will say South Asian population as a whole, which includes Pakistan, Sri Lanka, and Bangladesh also. What we found that we are having the type of lipid disorder where there is increase in triglyceride, low HDL, and LDL bad cholesterol, which is of smaller size. Secondly, what we found, another specific risk factor is the central obesity. You see, as a whole, obesity is increasing globally. So also we are facing in our country now. But a type of obesity which is specific in an Indian population is central obesity. It tone nikal aati hai, and then otherwise person is normal, but he is obese from the center part, which we sometimes call metabolic syndrome. And this is a very peculiar problem for that. What we say, thin, fat, obese person. BMI is not very high, but the central obesity is there. Thirdly, when we look into the tobacco consumption in our country, what we found that besides the cigarette smoking, the other part was the bidis, the indigenous smoking, the bidis, and thirdly, the chewing tobacco, which is again found to be independent risk factor for heart disease. So this is a peculiar type of risk factor which is not there in other parts of the world. Then we look into the genetic data, which we did study in our hospital at Sir Gangaram Hospital. And last 10 years, genetic studies were done in our hospital. That is the only study which is there at the moment from our country. And what we say that familial hypercholesterolemia, a condition which is highly prevalent in our country, is around 15% in young heart attack population compared to 8 to 10% globally in Western world, where young people are getting heart attack because of genetic reasons, which I will discuss, because there is a problem in the receptor of LDL cholesterol, bad cholesterol. And a lipoprotein little a new risk marker, which was well known to us 20 years, 30 years ago also, but now we just researched again to found that this is a very important risk marker for future cardiovascular disease, and it is a genetic risk marker. Again, in our country, general population has 25% of the general population has got high lipoprotein little a, which we say high means above 50 milligram, and this risk factor is also important. So both genetic risk factors are playing much more in India. And finally, the major factor which I will say you will like to know that is the lifestyle problem of our country. Sedentary lifestyle and bad cooking habits, then eating too much of carbohydrate food, because being a significant number of population being vegetarian, we take a lot of carbohydrates. So all these factors probably are giving us an explanation that we get a disease earlier. But your question that why they are dying suddenly, because people are aware of their blood pressure, they are aware of their sugar, because they both have got some symptoms, but they are not aware of their lipids or cholesterol. Because unless you do the testing, it is a true silent risk factor. And most of the fatalities which has happened in legends or cricketers or even singers, which we have seen on athletes, marathon, they are all culprit that they had high lipids and their blockages of the artery were there, which was not evident on test. So their rupture had sudden bleeding, clot formation, acute heart attack, and sudden death. This has come because of that.
That's very unfortunate, actually. What are the traditional risk factors like diabetes, high blood pressure, smoking, and cholesterol you mentioned? And what are the new age factors that are increasing risk? Is it poor sleep, stress, hectic lifestyle, or processed food?
Well, I think you have enumerated all of them very nicely. The traditional conventional risk factor, as we know, is the lipid disorder, diabetes, smoking, and hypertension. These are typical for, and what we say stress, which is there is some yardstick to measure all the risk factor except stress. Stress does not have any method of measuring something, and each person's stress is different, because for same level of stress for two different people will behave differently. Someone will take it very easy, someone will take very seriously. So stress is a risk factor, no doubt in that. So what they do, all of them, they push the LDL cholesterol, or what we say non-HDL cholesterol nowadays also, because there is some cholesterol in triglyceride also. So when the triglyceride cholesterol and the LDL cholesterol combine together, what we say non-HDL cholesterol, that enters into the artery wall and causes blockage of the artery.
Okay.
That's how the disease starts, in the heart artery, leg artery, and brain arteries. That leads to stroke or heart attack or even limb ischemia or gangrene. So these blockages when come, who pushes high blood pressure, diabetes, smoking and stress, they push LDL, bad cholesterol inside. Now, this is very well known to us now, and that's how we are working on that area to control risk factor, identify them earlier and try to control them. But your new risk factor, which you enumerated, they are really important. I think we cannot ignore that. The sleep is one of the important factor. And for that, we have now learned that we have good studies, and one study we also did also, that it is not only the duration of sleep, but the quality of sleep is also very important. And the most important thing is that in nature, the God or nature has made such thing that there is a sweet spot. I will say that a modest word has to be used everywhere. If you have high heart rate, if you've got high blood pressure, if you exercise more, if you sleep more, you eat more, you stress more, everything, you've got more sodium, you've got more potassium, you die earlier, you get more complication. Similarly, other way around, if you sleep less, you exercise less, your BP is low, your heart rate is low, you die early. So in between there is a sweet spot, a modest thing. So what this is for sleep, 6 to 8 hours of sleep is good enough. That is good enough. If you sleep less than 6 or more than 8 hours, is again harmful to us. Similarly, you said exercise. Same thing. If you exercise too much, too vigorous, extreme is also not good for health.
So everything has to be balanced.
It has to be balanced. It has to be modest. Everything has to be balanced except 3 things, which there is a linear relation. One is smoking. More the number of cigarettes, more is the chance of heart disease. Second is pollution. The more the level of PM 2.5, more is that. So they are linear. Rest everything is a U-shaped. Bad cholesterol is also behaving similar way. So smoking, bad cholesterol and pollution, they are almost looking like a linear relation. Rest everything is U-shaped with a sweet spot, or you say a balanced area. Yeah, that should be that. So these are the new risk factors. Then you say the other risk factor, which is very right, is the junk food, the food what we eat nowadays, especially the youngsters, those who are working for MNC, they are working against the time. Some are working with USA, some with the other countries. So their sleeping hours are very different. At that time, they are very much indulged in taking junk food, lot of sweetened sugary beverages. It is a dangerous thing. What we say colas and the juices, what they take. Rather, we always suggest our patient and friend what you should take. You can take lassi, you can take nimbu pani, or you can take coconut water, something healthy drink. Or in winter, you can take some herbal tea or green tea or lemon tea. Soups, exactly. So those type of things are. So people are indulged in that SSB, and that is the major reason of obesity now globally. So it is itself, the junk food eating has played a major role now, no doubt in that.
So processed food is also responsible.
Processed food is also not good because it takes more salt, and many of these chips and other biscuits and many other things, they have got trans fats. The trans fats are again bad. They increase your cholesterol level and they cause more heart attack. So these are the processed foods are definitely bad for that. Sleeping adequately is good. And there is another condition called snoring, where what we say
My
sleep
question
apnea.
is going to be on snoring too.
Okay.
So what risk factors are most dangerous for Indians as compared to the Western population?
So one is that the Indian, I said that there are risk factors like the central obesity, I would say, and getting all the risk factor relatively in a younger age. That has become one of the important reasons for Indian. In fact, the risk factors are same for everyone in the world. But Indians are getting more because we are acquiring earlier, and we have peculiar, like central obesity has been found, and genetic factor. We can't do anything to genetics. But the central obesity and lifestyle has a direct link. If you exercise more, when we look into the sedentary habit of 195 countries, we found we were from below 12th. We are so much sedentary, and it is much more in women compared to men now. And similarly, so sedentary habit is the one, and the food, the cooking media, how we cook the food, reheating of oils, for example, is again bad. So our unhealthy cooking, consumption of high amount of carbohydrate food. Normally, we should take in a balanced diet, 50% should be carbohydrate. And average Indian is taking 70%.
Oh my God.
And because of, one of the major reasons, probably maybe many of them are vegetarian, so they have to take the carbohydrate food more. But that immediately causes central obesity, increases your triglyceride, reduces your HDL cholesterol. So this lifestyle problems are playing a major role for Indian population. I think we have to be more active. We have to be taking more healthy food, and also try to avoid even chewing tobacco and BDs and cigarettes and all those factors which we have to be careful.
You said it right, absolutely, because our younger generation is neglecting, and as we all know, a lot of heart attacks are coming up in that particular age group. There's another factor which is stress. I know it is a big villain in our system, but apart from that, is there anything else also happening in our body when stress happens?
You see, stress, there are two types of stress, I will say. One is the acute stress. Another one is the chronic stress. The acute stress, something happens suddenly, you become very angry against, or something, grieving on something, some sudden death or something. So in that situation, what actually happened, for example, if a person has artery which is less than 70% block, then patient will not get any symptom of angina or heart problem. If it is above 70%, patient gets the symptom. This is an important thing we must understand. And even if you do tests like stress test, stress echo, stress thallium, this will also not be pick up the disease. Now what happens, sudden acute stress increases your blood pressure, increases your heart rate, and that causes stress in the blood vessel, and it can rupture the plaque and can cause acute bleeding and sudden death. Whereas the chronic stress population, which is chronically stressed because of the lack of sleep, lack of many factors. I mean, you can see in society they can have individualized factors are also there. Now, those stressful situations, generally they play with multiple mechanisms, what we have seen. One is the hemodynamic mechanism, that they have to have a heart rate high. Their blood pressure remains high for a longer period of time. Then what we say, metabolically, what we found also, that the hormones in the body, like adrenaline, noradrenaline hormones, these are the bad hormones. They are also much higher in this population compared to a person who is not stressed. Number third, there is inflammation in the blood vessels. There is oxidative stress in the blood vessels. So all those mechanisms by which the person gets the risk factors earlier, and he's got sustained risk factor, control of risk factor become a challenge. So stress itself definitely, and now it is been proven by a clinical trial which was done almost more than 20 years ago, called Inter-Heart study, where they have clearly shown the stress is one of the psychosocial stress is an important risk factor for heart disease. But between men and women, what we found, if a woman is having stress, and if woman is diabetic, or if woman is a smoker, then impact of these three risk factors in women is much more than men.
Oh, I see.
If a woman is having diabetes, her chance of developing heart attack is 4 times, but men 3 times.
Oh.
If she's a smoker, 3 times heart attack, men 2.5 times. And the psychosocial stress, again, similar way. They get more heart attack, 2.5 times more heart attack compared to men, they get 2 times heart attack. So these factors generally have been now identified, and there is no yardstick to measure stress, but there are questionnaires which are available during research. We take the help of those questionnaires to identify whether a person is stressed or not stressed.
Mm-hmm. You see, I mentor a lot of people, have totally about 52 years of experience over the years. One is, got friends who come and take advice. And I always tell everybody one thing. I say stress has never solved any problem. if you are stressful about what happened in your life yesterday and you are stressful what is going to happen in your life tomorrow, that means you are not enjoying the power of now
Oh, yes.
because of this particular thing. If you
Yeah.
keep your stress out and enjoy the power of now, you will be happier.
Yeah.
And believe you me, a lot of people have come back to me and said, Hemant sir, we listened to you in that particular situation. I said, take deep breath here if you get...
Exactly. This one, you see what we're saying, even we are advising yoga,
Yoga,
meditations, deep breathing exercises. I think they are definitely helping people. But sometimes counseling is needed.
Counseling is
And
needed,
we need the counseling from the special psychologist. They help them in taking care of their stress
Absolutely.
level.
Ajay, there's another myth that cholesterol is bad, we know. But people say they are very afraid to take statins. They say statins are more sort of harmful. What do you have to say on that? There is a little bit of controversy
That's right.
somewhere there.
Let me clear it first that if you ask me, the most strongest risk factor for blockage of artery which leads to heart attack, stroke, or is cholesterol. And this was almost more than 100 years ago. An experiment was done where the rabbits were taken and then they were fed with the high cholesterol diet, and then they saw the arteries of the heart and they found they were all blocked. That atherosclerosis, what we say technically atherosclerosis, which come up. The cholesterol enter, forms a form, and then there is a blockage sets in, and gradually blockage increases. After the 70% patient gets symptom, sudden 100% block causes heart attack, something like that. So there is no doubt about that experiment and what we have observed. So now we have got a lot of studies, like Birmingham studies, many other studies have clearly shown. And primary prevention and what we say secondary prevention trial. Secondary prevention trials are those who are suffering from heart attack. Primary prevention, those who have got only risk factor, but they have not suffered from heart attack. All these studies in last 30 to 35 years have shown clearly that if you take statin, if you reduce your cholesterol, your heart attack will be reduced. So if you reduce cholesterol by 40 milligram, 20% reduction in heart attack is known, very well known. 40% reduction cholesterol, 20% reduction in heart attack and stroke. All studies. Then they said, why not look for other important? Then they saw the genetic studies. Those people, because of some genetic metabolism like loss of function of PCSK, we say, their cholesterol level as such is low. Like we get 100, 120, 130 keeps on increasing, but some of them low, like 60 to 70 or 80 cholesterol LDL below. They do not increase because genetically they are like that because their receptors are so well functioning. And then they followed them for 50 years and they found they were the people who are living longest. So thereby proving the culprit is cholesterol. No doubt in that. Now coming to your important question, the myth of the statin part. And we have learned that the dietary contribution of reducing the cholesterol is not significant. If you look at the blood cholesterol in your body, the diet's contribution is at best 15 to 20%.
Oh, okay.
And the people also don't know which diet contains cholesterol. So simple rule is that to manufacture cholesterol, you need liver or maybe animal cells. So anything comes from the animal kingdom will have cholesterol. Milk, egg and meats, all meats, fish, chicken, mutton, whatever. They all will have cholesterol because they are animal products and cholesterol is manufactured in the liver. Anything coming from plant kingdom, you take fruits, vegetables, nuts, kaju, kishmir, akhrot, badam, all the soya product, they have no liver. Plant kingdom has no liver.
Oh, okay.
So all these products which are coming from plant kingdom will have zero cholesterol. So काजू के लोग myth है society में काजू नहीं खाओ जी cholesterol होता है. काजू has zero cholesterol.
Oh,
It cannot be. So any plant kingdom will not. So the dietary contribution is 15 to 20%. 80% is manufactured by the liver. And liver is generally genetically determined. This is what we have seen. So one thing is that the contribution of the diet is not very significant, it plays. And the role of the cholesterol, mainly manufactured in the liver. So what we found in our guideline, what we suggested finally, that if you want to live long, you have to take certain medicines. So what we have found, very interesting finding, that last 30 years of advancement of medical science, human beings' life has increased by 10 years. And when we look into the different departments, contribution to increase the lifespan of human being, the cardiology was the number one. 7 out of 10 years were increased lifespan because of cardiology. And when we look into the cardiology, which part has played a role? And the role was played by the lifestyle modification, 50%. That means exercise, good diet, stop smoking, chewing tobacco. 40% by the drugs. And you know who is the number one drug? Statin. Then came aspirin, then beta blocker, and some other anti-diabetic drugs. And only 10% was contributed by bypass surgery and stenting. So out of 7 years contribution of cardiology, the contribution of intervention was only 10%. It is the drugs and the lifestyle. They have controlled the risk factors, basically. They have controlled blood pressure, they control lipids, they control the sugar. So these three things were controlled by 90%. And that's how the lifespan of human being has come. So statin have played a role. Now coming to your last point about statin part. See, definitely, unfortunately, I will say, the media has gone many times haywire without looking into the details of the evidence from the clinical studies. They say, no, statin causes a lot of side effects. I do agree. The statin definitely can cause myalgia, like pains are well known to them. Some people, those who are pre-diabetic, they can become diabetic. In the liver and the kidney doesn't cause any problem. Liver, sometimes there is an increase in SGOT, SGPT, what we say liver enzyme. Again, very minimal, nothing. Many times, it is a nocebo effect, what we say, that people, they complain of, because we ask them a direct question to patient many times, क्या आपको पैरों में दर्द होता है? Then you start thinking, हाँ, होता है. It may be because of this statin. So otherwise, if you say statin is a very safe drug, like pain definitely occurs, diabetes, but this is dose related. The higher the dose you take, more is the chance of little side effect. But they are reversible side effect. The moment you reduce the dose, or you change the statin from one rosuvastatin to atorvastatin or pitavastatin. The three are commonly available. Or now we have got patients, drugs like agitamide, which is given to patient who is statin intolerant. I've got many patients, just they can't even tolerate 5 milligram of a drug because they get leg pain. So we give them agitamide, we have got bempedoic acid, and now we have got injectable drugs like inclisiran. And we have got injection will come up. Inclisiran is becoming very popular because twice a year injection only. So good compliance and sustained reduction in cholesterol level. And of course it is costly, but still I will say a lot of patients are affording this drug. So that's all. So so statin probably has been unfortunately, and we have a data now from the London and from USA, the insurance company and for Biobank, those patients, those who are already suffering from heart attack and they needed statin, while looking at media, they stopped statin, they had recurrent events.
Oh my God.
So that shows clear-cut evidence that cholesterol is the main culprit and it should be taken, and statin is a safe drug.
Safe drug.
A safe drug.
Coming back to, again, the beliefs that we have these days, a lot of people think even now that the ghee, is dangerous, but the sugar is harmless. How do you...
The knowledge about this thing was well known almost three decades ago with a good research from Harvard Medical School. But because of some industries' involvement, this was not hidden. And now we have a good study which has clearly shown, a pure study, many other studies have clearly shown that what you said, it is opposite. The sugar causes more heart attack than the ghee. I will tell you, because the explanation for that also. This statement is true for general public. And that's why you must have read in the media that America has removed cholesterol as an offending agent for the heart disease. This has been, it is true, which is a fact, because dietary contribution is only 15-20%. So what we found that if you are consuming a small portion of what we in the normal diet say 50% is carbohydrate, which unfortunately is 70% in our country. 25 to 30% should be protein, less 15 to 20% should be fat. And in that, the saturated fat, which is there in the animal products, and that is ghee. because it comes from the milk, ghee and butter and all.
Haan ji, haan ji.
Now that 7% of the saturated fat is allowed to normal human being, normal general population. I'm not talking about heart patient at the moment. I'm talking about general population. So what we saw that if you take small quantity of desi ghee, which should be less than 7% of the daily calorie intake, or small quantity of mutton or chicken, then the LDL cholesterol goes up, HDL cholesterol also goes up, the ratio between LDL and HDL remains normal, same. Whereas if you take lot of sugar, lot of carbohydrate food like chapatis or more of rice, potatoes, carbs and pizza, pasta and all that, and sweetened sugary beverages particularly, the triglyceride goes up. The moment triglyceride goes up, HDL cholesterol goes down. HDL is a good cholesterol, which brings out LDL from the blood vessel wall. And HDL goes down, triglyceride level goes up. The LDL, since the vegetarian product do not have LDL, the LDL remaining same, but what happened because of high triglyceride, the LDL size becomes smaller. So LDL size becomes smaller, but the ratio between LDL and HDL now change because HDL is low. The ratio is changed. So ratios change and this has become smaller. It enters into the artery wall much easier and causes more blockages of the artery. So thereby proving that the sweets can cause more heart disease compared to a small quantity of such ghee or butter. That's right.
Now, many people have normal ECGs, but they still have risks, right? And that is because of some calcium score test and things like that. And will you please explain to the audience what does each score range? 0, 1 to 100 and above 400.
Hemanji, I think this is one of the most important questions what I'm facing in clinical practice these days. You see, one thing, let me start simply that one by one, that the common problem what we face in the society nowadays is that I'm giving an example. Some young boy he was on treadmill, he collapsed and died. His friends were there. They say, oh, Dr. Saab, he was the fittest person among our friend circle. No blood pressure, no diabetes, no smoking, good exercise, everything is doing. Why he died suddenly with heart attack? So they will call me, Dr. Saab, today I want to come and see you because I've got blood pressure. Someone will say I'm smoker. Someone will say, no, mera cholesterol high hai, my family history high hai. Main aaj hi aapko dekhna hai. I said, okay, come, let's see what is to be done. So they have one question only to ask me कि डॉक्टर साहब कैसे बता सकते हो कि मेरी arteries में blockage शुरू होगी है कि नहीं? This is a question. So what earlier people, when this modality of investigations were not there long ago, the people used to go for stress test, a TMT test. Later on it becomes stress echo, then becomes stress thallium. And it used to become normal. When people say test normal है, and cardiologists and people used to believe कि उनको heart की बीमारी नहीं है. It was a wrong conclusion from that. And this is the example of many, many celebrities. Those who have done their full cardiac checkup and within 2 months they suddenly died. And they are top like actors, our friend also from Europe. And many, they all have done their cardiac test, including thallium. And yet they died within 2 months with sudden cardiac death. So, uska explanation is only one, that they had blocked artery, which was not picked up by stress test or stress thallium, because stress test and stress thallium will pick up blockage of the artery if it is more than 70%. By that time, most of the patients also complain of symptom. But sometimes asymptomatic patient, they can pick up. But if the blockage is 50% or 40%, will not be picked up by the all these tests, TMT and all that, and patient and doctor also get a false sense of security. Ki nahi ji, mere ko kuch nahi hai. But yet they died. Because the mechanism is that the rupture of the plaque, which causes bleeding, and there is no collateral vessels, so they die suddenly because of that. So there's all top people. You look at our actors and singers, they all died young age. All top people.
This is because something to do with the calcium score test?
No, I'm coming to that part. So that's how. So that is become a limitation of the TMT test and all that. So research came up, and that's how came the CT coronary angiogram. and which has come in last 20 years, and that has really helped us a lot in the society, particularly to cardiologists, to answer this question. Because we ask now our patient, okay, you go and get a calcium score. There you don't have to put a dye, you don't have to be exposed to the radiation. Otherwise, normal CT gives a radiation around 100, 150 X-rays and a lot of radiation there. And dye goes, if the person is diabetic or having some kidney problem, then they get the kidney gets spoiled with the dye. So those issues are there with the CT angiogram. So what we say, instead of CT angiogram, just do a calcium score. So what we say, if the calcium score is positive, that means many of my young people, calcium score is 0. So that is also a very important point, which I will discuss. But if your calcium score has come even 10, 20, 100, 200 or 500, that means one thing is clear, that the cholesterol has entered, it has started blockage, and over that calcium sits. Okay. So calcium gives us an indirect clue that the cholesterol has already entered and your blockage, बीमारी की new पड़ चुकी है, something like that. The foundation has laid now, and if you don't control your cholesterol, the disease will progress and ultimately we will get stent or bypass, something like that. But that does not qualify for giving aspirin. That we must understand. तो जिनका कैल्शियम निकल आता है, तो कई बार मैं पेशेंट को बोलता भाई तुम सीटी करा लो, तुम्हें डायबिटीज़ नहीं है, चलो तो हर जरूरी नहीं होता कि हर डायबिटीज़ को हम सीटी नहीं करा सकते, हर पेशेंट को करा सकते. जिनको किडनी की प्रॉब्लम होती है उनमें एंजियो नहीं करते, वी डोंट गिव डाई टू दैम. So we tell them to get तो वो पिकअप कर लेता है 10%, 20%, 30% ब्लॉक आर्टरी, जो TMT नहीं पकड़ पा रहा, लेकिन इधर 30% ब्लॉक आर्टरी हमें नजर आ गई, तो दैट पर्सन गेट्स अलर्ट कि भाई मेरी ब्लॉकेज तो शुरू हो गई है. नो द ओनली मेथड टू प्रिवेंट प्रोग्रेशन ऑफ द डिजीज इज टू टेक स्टैटिन.
Okay.
That's all. So that is, and now coming to your next question, कि what is the level? The 100 है किसी का कैल्शियम, 200 है, 400. We say 100 में रिस्क बढ़ जाता है. मैंने रिसर्च says 400 में थोड़ा रिस्क ज़्यादा होता है. Next 10 years of getting heart attack becomes higher.
So much better higher. To have below.
Below better to have below, और ideally 0. वो कई बार नहीं होता with aging. But remember one thing, I've got many patients जिनका कैल्शियम स्कोर 2000 है, 2500 है, और मैंने उनका एंजियो कराया. जो एक और चीज़ वी मस्ट लर्न दैट इफ़ यू कैल्शियम स्कोर इज़ हाई 800 एंड अबव समथिंग लाइक दैट, देन अवॉइड गेटिंग ए CT एंजियो, बिकॉज दैट विल not able to give you exact blockage of the artery, because the calcium is too much on the artery. Your reading will be not accurate, so it is a wastage. Because क्या होगा उसमें वो लोग लिखेंगे 40 से 50, 50 से 60, 60 से 70, and you are confused. So then we say you go for other stress test to know अगर stress test negative है इसका मतलब blockage 70% से कम है, तो we are secured. Or if you want to be very accurate, go for a conventional angiogram और वहाँ से देख लो. तो I have got lot of patients जिनके calciums को 2000 2500 हैं, जब मैं एंजियो करता हूँ तो 20-30% निकलती है. So this is also known. And other way around is also very important, which I want to convey to public now, and that if you have a typical history of angina, typical history of angina क्या होती है? If you walk or exert physically, mentally also to some extent, then you get discomfort above the umbilicus. If you get a central discomfort, chest में heaviness आ जाए, भारीपन आ जाए, घुटन हो जाए, constriction हो जाए, or you get a pain in the neck or in the shoulder, and it increases while walking. And with the moment you take rest, symptoms subside हो जाए. तो this, and even jaw pain. Some patient को jaw pain हो जाते हैं लगता है. तो और कईयों को इस तरह भी होता है कि जब वो चलते हैं तो वो कहते हैं हमारी ना गैस अटक गई, हमने बर्पिंग की तो हमें अच्छा लगा, तो वो उसको गैस्ट्राइटिस समझते हैं. इट इज़ ए कॉमनेस्ट मिस्टेक इन सोसाइटी, बिकॉज इफ़ यू गेट ए सिम्टम ऑफ गैस्ट्राइटिस वाइल वॉकिंग एंड इट गेट्स रिलीव विद बर्पिंग, इट इज़ नॉट गैस्ट्राइटिस. गैस्ट्राइटिस हैज़ टू बी कॉमनली लिंक्ड विद फूड, नॉट विद वॉकिंग, दैन इट इज़ एंजाइना. ये सबसे कॉमन मिस्टेक है सोसाइटी में. इसीलिए जो हादसे होते हैं, कॉम्प्लिकेशन होती है, दे डोंट कम टू द हॉस्पिटल इन टाइम, दे कोलैप्स ऑन द वे बिकॉज ऑफ दैट. सो व्हाट हैपन इन दैट सिचुएशन, अगर कैल्शियम स्कोर 1 भी है, मैं उसकी एंजियो करूँगा, क्योंकि आई एम कन्विंस्ड दैट दिस पेशेंट को एंजाइना है. और ये भी है कि 10% पेशेंट में कैल्शियम के बिना भी ब्लॉकेजेस होती हैं, जिसको हम बोलते हैं सॉफ्ट प्लैक. तो ये भी समझना जरूरी है. डोंट बी वेरी हैप्पी इफ यू आर यंग मैन बट कैल्शियम स्कोर इज 0, बी हैप्पी, ओके फाइन, वी आर फाइन. बट इफ कैल्शियम स्कोर है तो एंजियो करके देख लो कि कितने % है, दैट गिव्स यू वार्निंग, स्टार्ट स्टैटिन. no aspirin.
Wonderful. So, what is the early sign that people should not ignore? You did mention about just
these
now
are
in
the
your this thing.
symptoms.
But but what people should not ignore? What are the signs?
You see, if you get a
you
chest,
mentioned that your chest pain and
your chest
shoulder,
pain,
jaw.
jaw pain and all that. The common myth in society that everyone thinks कि हार्ट की बीमारी होगी तो पेन होगा. पेन 25% में होता है. 75% पेशेंट में पेन नहीं होता. They get heaviness and most common in the center. It can be on the right side. Many patient बोलेंगे नहीं जी मेरे को तो राइट साइड में हार्ट डिस्कम्फर्ट हो रहा था तो ये तो हो ही नहीं सकता हार्ट का, which is wrong. It can come any part of the body, jaw. मेरे पास पेशेंट ऐसे है उसको खाली टीथ में पेन होता है, दांतों में, बट होता चलने से, रुक जाता तो ठीक हो जाता है. एंड ही वेंट टू डेंटल सर्जन, बहुत कुछ हुआ ट्रीटमेंट, बट ऑल हार्ट. So remember one thing, any symptom above umbilicus which is coming on exertion and getting relief with rest in any form of symptom, किसी को choking होती है, किसी को घबराहट, कुछ भी होता है, this is nothing but angina. Don't ignore it. This is the earliest sign which God has given you warning. Many patient जो हमारे पास हार्ट अटैक के साथ आ रहे होते हैं, मैं जब उनको हिस्ट्री पूछता हूँ तो सबको अराउंड 70 से 80% लोगों को गॉड ने, भगवान ने उनको वार्निंग दी होती है, वो परसीव नहीं करते. और उसको मसल पेन कहते हैं, कोई उसको गैस कहता है, लाइक दैट.
So, how important is the family history for premature heart attack?
Very important. I think one of the most important history. As I said, that 50% of the people in India are getting heart disease below the age of 50. This is young. By definition, young हम उसको कहते हैं किसी भी men को 55 से नीचे हार्ट अटैक हो और women को 65 से नीचे हार्ट अटैक हो. This is young. This is by definition young. अगर किसी फैमिली में ये हिस्ट्री है, उनके बच्चों को अलर्ट हो जाना चाहिए कि कहीं ना कहीं गड़बड़ चल रही है फैमिली के अंदर में. हाँ, कुछ होते हैं स्मोकर, फिर हम उसको फैमिली हिस्ट्री में नहीं मानते. किसी को स्मोकिंग का हार्ट अटैक हो गया यंग एज में, देन वी डोंट गिव इंपॉर्टेंस टू दैट पर्सन. दैट इज़ नॉट जेनेटिक, दैट इज स्मोकिंग. और आई विल से डायबिटीज़ है तो वो भी एक फैक्टर बन जाता है. बट बिसाइड किसी को डायबिटीज़ नहीं है, स्मोकिंग नहीं है और यंग हार्ट अटैक हो रहा है, तो एक ही कारण होता है, जेनेटिक. एंड दैट जेनेटिक प्लेस थ्रू नथिंग बट कोलेस्ट्रॉल. Nothing but cholesterol. That is what I said. Familial hypercholesterolemia is a disease where there is a defect on the receptors on the liver, where LDL receptors are defective, where you have more LDL cholesterol level. And this was diagnosed, detected 40 years ago by Dr. Brown and Goldstein, and they got the Nobel Prize for detecting this disease, familial hypercholesterolemia. But in spite of 40 years long period, we are not diagnosing this familial hypercholesterolemia in our country. And those who are यंग हार्ट अटैक जिनको है, अगर वो स्मोकर नहीं है, अगर वो डायबिटिक नहीं है, तो हमेशा सोचना चाहिए कि ये फैमिलियल हाइपरकोलेस्टेरोलेमिया हो सकता है. उनके बच्चों को एक ही काम है, इमीडिएटली लिपिड प्रोफाइल कराएं और एक LPA कराएं, लिपोप्रोटीन लिटिल. जिसका भी कोई इलाज नहीं है, लेकिन इट इज़ ए मैग्नीफायर, इट इज़ ए वेरी इंपॉर्टेंट. इसलिए अभी आजकल हम लोग क्या बोलते हैं, हर लिपिड प्रोफाइल के पेशेंट को हम बोलते हैं एटलीस्ट ज़िंदगी में एक बार लिपोप्रोटीन लिटिल ए जरूर कराओ. इसलिए इंपॉर्टेंट है. अगर आपके लेवल 50 मिलीग्राम से ऊपर निकल आते हैं LPA, दैट मीन्स योर 100 milligram ऑफ कोलेस्ट्रॉल विल बिहेव लाइक 130. So there are two people with 100 milligram of cholesterol, LDL, one having a high LPA, this 100 will behave like 130. His chance of developing heart attack is much earlier in age. So this should be done.
Are the preventive checkups truly essential?
Well, I think, like for example, this is the family history of young heart attack. किसी का हुआ है फैमिली में, मदर फादर को, किसी को ब्रदर को हो जाता है, some patient and all that. Then as I said, we should be alert to the family. So they have to get their executive health checkup. And executive health checkup में basically हमें क्या देखना होता है कि डायबिटीज़ तो नहीं है, थायराइड तो नहीं है, और मेनली लिपिड एंड LPA. ये देखने से हमें थोड़ा आइडिया हो जाता है कि वी आर प्रोन फॉर दिस डिजीज इन फ्यूचर. एंड देन दोज हु गॉट मल्टीपल रिस्क फैक्टर, हम उनको कहते हैं कैल्शियम स्कोर भी करा लो, क्योंकि कैल्शियम स्कोर एड्स टू दैट थिंग. तो प्रिवेंटिव चेकअप यूजफुल है. और हमारी गाइडलाइन जब हमने लिखी उसमें हमने एक सबसे इम्पोर्टेंट मेंशन किया कि जिन बच्चे जब स्कूल से कॉलेज जाते हैं 18 साल के, कॉलेज में एडमिशन के लिए जाते हैं, दे शुड नो नॉट ओनली दे विल फिल अप द फॉर्म फॉर एडमिशन, बट दे हैव टू फिल अप 3 points. व्हाट इज योर ब्लड प्रेशर, व्हाट इज योर शुगर एंड व्हाट इज योर कोलेस्ट्रॉल. क्या होता है कि शुगर ब्लड प्रेशर ईजी है, उसमें कईयों को सिम्टम हो जाते हैं और वो डिटेक्ट करना बड़ा इजी है। बीपी चेक कर लिया जी, चलो उंगली में सुई लगाई तो शुगर होगी। कोलेस्ट्रॉल कोई चेक नहीं कराता और वहाँ सबसे ज़्यादा फंसते हैं। जितने बड़े बड़े हादसे दुनिया में हुए हैं, सिंगर के, माराथन, ये सारे एक ही कारण से हुए कि उनके जो आर्टरीज थी वो ब्लॉक पड़ी थी और एक्सरसाइज से या कुछ और एक्सर्शन से या स्ट्रेस से वो रप्चर हुई, सडन डेथ होगी उनकी, बिकॉज ऑफ हार्ट अटैक होता है, अरिथमियाज हो जाते हैं एंड दे डाई सडनली। तो इसलिए प्रिवेंटिव चेकअप्स आर इंपॉर्टेंट। दैट्स व्हाई से एट द एज ऑफ 18 फॉर जनरल पब्लिक। बट जो पेशेंट्स फैमिलियल हाइपरकोलेस्टेरोलेमिया के हैं, जिनके हार्ट अटैक, मैं आपको एक एग्जांपल देता हूँ। मेरे पास अभी लास्ट मंथ की बात है, ए फैमिली फ्रॉम ग्वालियर केम, दैट बॉय केम विद हार्ट अटैक, सो वी पुट ए स्टेंट, ही इज़ 38। सो आई आस्क्ड हिम, मैंने पूछा, कहता स्मोकिंग नहीं करता डॉक्टर साहब। हाँ, मेरे फादर डाइड एट द एज ऑफ 47 एंड ग्रैंड फादर डाइड, ही डजंट नो बट सडनली ही डाइड, एंड हिज यंगर ब्रदर ऑल्सो डाइड एट द एज ऑफ 32. सो द वाइफ ऑफ द पेशेंट टोल्ड मी, डॉक्टर साहब बीमारी क्या? मैं कि ये फैमिलियल हाइपरकोलेस्टेरोलेमिया, आप इसका कोलेस्ट्रॉल देखो कितना आई है आपके हस्बैंड का, जिसके अगर जो उसको पता नहीं, जब उसके यंगर ब्रदर की डेथ हुई तब उसको टेस्ट करना चाहिए था, उसने नहीं किया तो आज फंस गया, बट बचाव हो गया, स्टेंट पड़ गया, बच गया। तो कहता है मेरा तो एक बेटा है, उसका 4.5 साल का है। तो मैं कहा अगर बेटा है तो आप उसका लिपिड प्रोफाइल कराओ और LPA कराओ। उसने लिपिड कराया तो बेटे का LDL was 239।
Oh my God।
सो आई मस्ट से दैट, तो वो जब हुआ तो मैंने बोला जेनेटिक टेस्ट करते हैं। जेनेटिक टेस्ट क्या पॉजिटिव आ गया, LDL रिसेप्टर पॉजिटिव आया। अब वो 4-4.5 साल के बच्चे को मैंने स्टैटिन डाली है और कोई मेथड ही नहीं है उसको प्रिवेंट करने के लिए, तो ही विल ऑल्सो गेट डिजीज बिटवीन 30 to 40. So he's on statin. I've got 14 children with me, those who are on statin. And one must say now that what we have taught people now, that for a general public, keep your LDL below 100. For a patient who has got blood pressure and diabetes and central obesity type of risk factors, keep their LDL below 70. And those who have got heart attack, keep it below 55. 55. So this 3 figure we must remember. 100 for general, 70 for diabetic and hypertensive smokers, and 55 for heart attack. And another point जो मेरे को अभी बड़ा इंटरेस्टिंग नजर आया, वो जो मेरे एक पेशेंट ने बताया कि the laboratory report of lipid profile is also contributing a lot of heart attack in the country.
Is that right?
Yeah, I'll tell you how. You see, normally the good laboratory they say less than 100 for general public. पर मैंने बोला ना, हार्ट अटैक का 55 से नीचे होना चाहिए। और जिसको डायबिटीज 70 से नीचे होना चाहिए। तो मेरा एक पेशेंट है, ही मूव फ्रॉम दिल्ली टू दुबई, तो उसको स्टेंट डाले थे हमने। तो 2 साल के बाद उसका फ़ोन आया, डॉक्टर साहब आई वांट टू कम बैक टू दिल्ली नाउ एंड व्हाट टेस्ट आई शुड गेट इट। आई सेड गेट ए लिपिड प्रोफाइल एंड LPA, दोनों करा के लेके आया मेरे पास, एंड ही डिडंट कम। He met me in a party somewhere. So मैं बोला, what happened to your lipid profile? He said, डॉक्टर साहब मेरा नॉर्मल है। तो मैं सोचा क्या आपको तंग करूँगा। मैं कहा दिखाओ तो सही। कहता आपके अस्पताल में हुआ है। मैं कहा दिखा रिपोर्ट। दिखाई तो LDL was 91। तो ही वॉज थिंकिंग, मैं कहते देखो लिखा लेस देन 100 इज नॉर्मल। मैं कहा 91 है। मैं कहा नीचे सेंटेंस पढ़ा क्या लिखा है, खाना का। मैं देख एस्ट्रिक्स लगा हुआ है, गंगाराम की रिपोर्ट है, उसमें एस्ट्रिक्स के नीचे क्या लिखा है, लुक फॉर योर रिस्क एंड अकॉर्डिंग टू द रिस्क योर गोल ऑफ LDL। तो रिस्क मैंने बोला देख लिखा लो रिस्क, हाई रिस्क एंड वेरी हाई रिस्क। वेरी हाई रिस्क पीपल आर दोज हु पुट इट स्टेंटिंग बाईपास, तो उसके लिए वेरी हाई रिस्क इज टू बी बिलो 55। तो तेरा 91 तो हाई है। तो he did not agree, and believe me, within 3 months he had again angina.
Oh my God.
So this is
So moral of the story is please listen to your doctor.
and the lipid profile report has to be uniform.
Absolutely.
And should give that clear about the goal and your risk profile.
You know, there's something that you were about to say. I said I have this question. How important or how this thing snoring can important is snoring true in relation to the heart attack?
Snoring, people used to say that कि ये कुछ नहीं है जी, घोड़े बेच के सोया है। इनफैक्ट अगर मुझसे पूछना, ना घोड़ा बेचा, ना गधा बेचा, ना खुद सोया, ना किसी को सोने दिया। So these snorers, they are generally people, is not that uncommon in the country, and people used to say it is not a disease. And what we have done now, 3 decades of disease, with my colleague in Gangaram Hospital, we did a lot of research, and now worldwide everyone knows that snoring is a disease. इसका मतलब है कि इस स्नोरिंग के साथ लिंक्ड है हाई ब्लड प्रेशर, sugar, lung disease, stroke, heart blocks, many diseases are. कई बीमारियों का जड़ ही स्नोरिंग है. और वो कई पेशेंट होते हैं मेरे क्लिनिक में अंदर घुस रहे होते हैं, मेरे को पहले पता चल जाता है कि ये स्नोरर है. वो टिपिकल होता है, उसकी गर्दन छोटी होगी, थोड़ी मोटी होगी, पेट बाहर निकला होगा, थोड़ा सा हैवी वेट का होगा. ये टिपिकल पिक्चर होती है. तो मैं वो बैठता है तो साथ में वाइफ भी बैठी होती है, तो वो मेरे को बोलता है कि ये बीपी बढ़ा हुआ है जी, ये कोलेस्ट्रॉल बढ़ा है जी, जो चलो ट्रीटमेंट होता है. मैं उसकी वाइफ को पूछता है कि आप सोते हो ठीक से? कहते व्हाट डू यू मीन? मैं कहा जी आप सो पाते हो ठीक से? तो हंसने लगते कि क्यों पूछ रहे आप? मैं कहा ये स्नोर करते हैं. कहता आपको कैसे पता है? मैं कहते हैं मैं तो 35 साल से झेल रही हूँ इनकी स्नोरिंग. तो मैं कहा क्या हुआ? कहते जी ये तो इतना लाउड है कि वी आर नॉट आई स्लीप इन सेपरेट रूम, चिल्ड्रन इवन कांट स्लीप नेक्स्ट टू हिम. एंड कहते हैं सबसे बड़ी परेशानी होती है व्हेन ही इज ट्रैवलिंग, द कोर पैसेंजर सारी रास्ते इनको बददुआएं देता है. तो समथिंग लाइक दैट. तो यू से दिस
there is a relation that we snoring also
snoring has clear cut relation to blood pressure and diabetes and that particularly lung disease. So they have very typical complaint. जैसे वो चढ़ेंगे चढ़ाई में तो उनको सांस फूलता है. तो स्नोरिंग को इग्नोर नहीं करना चाहिए, उसको पकड़ के. the commonest one of the best method is to reduce weight. But I've got lot of patient, I will say 30 to 40% patient, those are not overweight, yet they snore because of the structural problem in the neck,
nasal, and
because the palate drops down and then they have that. So ENT checkup is must, but sleep study should be done, and the answer is to get a CPAP machine. So they put that machine and sleep so that they can sleep and next person can also sleep.
So would you like to tell anything to the viewers with regard to this ailment that we have discussed?
About the cardiovascular disease?
Yeah, any precautions they need to take and things like that?
Well, I think I say always be modest in everything. I mean, everything should be modest in life. If you do that, अति कभी ना करो किसी चीज़ की ना. Excess and down, not good. Modest of everything. So if you do exercise regularly, eat all type of food. We don't deny that whatever food you want to eat, but in modest quantity. Sleep well, and also one thing I will definitely say, not to smoke. And another area people they ask question about alcohol. कि भाई alcohol पीने से heart attack कम होते हैं. You see, there were some studies which came that if you consume small quantity of alcohol, like 30 ml, 2 pegs for men and 1 peg for women, 30 ml, or 150 ml of wine or 1 pint of beer, then possibly if you are a healthy person, then your chances of developing blood pressure, stroke, heart attack may be less compared to teetotaler. This was the studies which were showing it initially. But later on, the studies which were done, and particularly the study from India where we participated, it did not show a U-shaped as people have found in other studies in the past. It showed a J-shape for India. That teetotaler and modest drinker are same. You cannot say you're better than teetotaler. That's one fact. There were many reasons for that. And later on, all the studies they came, they said no. Even a drop of alcohol is not good. And because they say it is directly linked to cancer. The malignancy, definitely evidence hai. That's why WHO has given a black box warning now that alcohol is type of like smoking injurious to health. Yeah. But yes, we say, okay, if you're a relaxed person, you are taking small quantity of alcohol and you are a healthy person, not having liver disease or anything like heart failure or problem, then that probably may not harm you. But we do not prescribe alcohol to people. Because it has got an addiction power. So we cannot prescribe. But someone is consuming high amount of alcohol, we always suggest them to reduce it. If you're addicted, we say stop it. But if you're consuming small amount, then it's okay. This is not much of a health hazard otherwise, except for the malignancy part, which people say. And for exercise, instead of going to gymming is okay. Some youngsters, they go to gymming. We normally say 6,000 to 8,000 steps per day is very simple method of exercising. And try to avoid tobacco in any form. Sleep well, eat well, enjoy friends, company of friends, and I think that probably will help you and keep your cholesterol level low. Because the moment you keep your low cholesterol, keep your blood pressure normal, keep your sugar normal, then probably your lifespan definitely will go beyond 90.
Wonderful.
Beyond 90 or maybe 100,
Maybe
I will
100.
say.
Well, thank you so much, sir, for coming and sharing your experience and your thoughts on one of the most talked about problems in our country today. I'm sure all my viewers are going to be very grateful to you because they will be getting a lot of benefits from the suggestions that you have given. Ladies and gentlemen, if you have a story to tell or if you want to give us any suggestions with regard to our content, please do get in touch with us. Thank you so much and Jai Hind.